Facebook, and it says I'm streaming, so we're good. Y'all, I am super excited today to have who I get to actually call a friend, and just a blessing in the community. I told him I was going to butcher the first 5 minutes so he can laugh at me while I stumble around for a little bit. But super excited to have Dr. Brad Gloyeske join me live today. Dr. Brad, along with his wife, Dr. Mandy, own Gloyeske Family Chiropractic up in Oxford, Ohio. Like I said, they're a blessing to the community. I am lucky that I live close because when I do some kind of silly things and my body might need a little bit of tweak or a little bit of help from an outside influence, I get to call my friend and he's kind of gets to laugh at what I did and then help me out. And I walk in and feeling one way and walk out feeling a lot better, which in all honesty, if you read a lot of the reviews, you'll see that is a common theme. And I know I've referred a lot of people to Dr. Brad, and most people kind of give me I don't know. I'm like, dude, just go. And they're normally after when they come, no, before. And then normally when they come out, they're like, all right, man, you were right. I should have listened to you sooner. So Dr. Brad, thank you so much for joining me today. I think this should be fun. Sharing a little bit about your story.
Thanks for having me.
Yeah. So before we get started, I know we're going to take we're going to talk a lot about the carnivore diet, or a little, like, kind of give a high level of the carnivore diet. I'd like to know, like, I think a lot of people would like to know what services do y'all offer up at Gloyeske Family Chiropractic?
Well, we're chiropractors, obviously, so we do offer the chiropractic care side of things, rehab, therapy, stuff like that. Pretty much treating your musculoskeletal issues, whether it be, the low-hanging fruit for chiropractic is low back pain and neck pain. Then you have your headaches, but I also treat a wide variety of extremity issues, anywhere from the hip, knee, ankle, into the foot. And then we'll treat pretty commonly right now shoulders, elbows, and wrists too. So kind of the whole body approach from a chiropractic care standpoint, which I love. I've always taken the approach, everything's connected. So we'll work on that head to toe situation. And then we do offer functional medicine and nutritional consultation in the office as well. So,
are you still doing consultation with functional medicine remotely as well? It's like anybody?
Yeah, that's basically been, here in Oxford, it's been the sole way we've been doing it. It's virtually, with everything going on with COVID, which is nice. I really like that we can continue to spend that much time with folks in a virtual manner, and people like it anyway, so they don't have to leave their homes or work wherever they are. So
absolutely. And it also, like, if I got my friends in Hawaii that maybe don't have somebody that are there, it's like you might have to get up early to call Dr. Brad, but just because of the time zone difference or whatever,
right? Yeah,
you can call and
yeah, that has been the cool thing. I know we're in Oxford, but we have had some out-of-staters, so it's been really nice.
That's awesome. And then does Dr. Mandy, your wife, I know she is there on Tuesdays and Thursdays. What else does she do? Because I know I'm gonna.
Yeah, so Mandy, my wife, she is a chiropractor also, and she's actually also a doula. She just started her own little kind of private practice within our practice, and she's focusing on pregnancy and pediatrics. So she'll do that side of things, and then if she gets called in for a birth, she'll go and do her doula thing. She actually just left, what was it, Friday going into Saturday morning. So I suppose Saturday morning, 2:30 a.m., she was out from there till 4 p.m. Sunday. Mind you, she's also 21 weeks pregnant. So
congratulations. I was going to
thank you.
Like high five, like that's awesome. I know. Yeah, virtual.
Virtual.
As far as at the office, like what age range of patients are you seeing up there? Obviously.
Oh man, yeah, I'll see anywhere from babies, 6 months old, all the way up to I think the oldest patient I've had has been in their mid to late 90s or so. So I'd say the most common range is, anywhere from 30 to 50 or so, 30 to 60. It's a very wide range. So
well,
yeah, I call them the common folk.
Yeah. Well, that's when I mentioned before that I referred a lot of people would hesitate because they're like, dude, I've kind of, and I'm not knocking anything about anybody else, but they're like, I don't know. It's always like I'm in a wrestling match or something. And that's even what I told you the first time. And you were like, no, dude, it's completely different. You like the way you, obviously there might be some situations where you need to physically move something or whatever, but the way you practice, and I don't know the term or the tool, but I know that it works. And I know that I didn't feel like you were trying to beat me up for a half hour and have fun doing so, because that had been some of my experiences everywhere else.
Some people feel beat up. That's okay though.
Well, that's different, but the physical act during it is not.
Right.
Anyway.
It is different. We'll leave that out though for people they can experience that firsthand if they like.
I might have ruined the surprise. If anybody visits you, they might get all stretched out before they come in thinking they're in. Right. All right. So I know you mentioned functional medicine. What's the difference between like functional medicine versus a conventional style medicine? Is there, what's the differentiator? What sets you apart type thing?
Right. I think you'll get a lot of different opinions, and not to say that mine is necessarily correct. I think in general, if you look at conventional medicine, and it's not that there's a shortcoming to conventional medicine. I feel like there's a time and place for everything, but I think that the point of conventional medicine is more so symptom management than anything, or disease management. In a sense, like, hey, you got high cholesterol, for instance, that we were kind of talking about before we got on here. You have pain, here's a pill for that, or here's an injection for that. It's meant to get you a pretty quick result to change, almost in a way, a test result. But I think it's more so symptom management, whereas functional medicine kind of focuses on the root cause, or as I like to put it, kind of a return to natural health. So if you figure out the root cause of whatever the disease or the condition that you might have is, then you can address it and hopefully, at least in some cases, fix that said condition. But I think for me, I've always viewed functional medicine as a return to your kind of optimal human physiology. I think we might get into my history here in a second, but I think that for me, my logical brain always went to when I was going through my struggles and such. I mean, not everybody had to take these medications and pills and supplements, a million years ago. Like when we were out in the tundra in the wild, hunting woolly mammoths and such, we didn't need any medications and stuff like that. So I really view functional medicine largely as figuring out what might be at the root of your condition, whether that be, toxins, environmental, poor dietary or lifestyle choices, bad sleep management, stuff like that. But I view it as more of a return to our optimal kind of human physiology.
So you kind of led into it, but like, how does one get started? Like, how did you go down that path as far as one, getting your, I can't remember what your bachelor's was in.
Exercise science. Yeah.
Well, yeah. And then your chiropractor, your doctor of chiropractic, and then all the stuff you've been doing as far as functional medicine goes. Like I don't guess there has to be, but I know that there's a reason why you got into it. What led you down that path?
I don't think that's uncommon either. I think that a lot of whether it's an MD, naturopathic, or chiropractors, I think most of them that are partaking in functional medicine, they have on some level a story behind it themselves, or a struggle behind it themselves. For me, I think I like to tell, if I'm trying to relate to a patient, maybe about something that they've been through that I've been through. I like to tell them that I've been through kind of two journeys myself. The first kind of led me to chiropractic in general. From age 5 to 12, I was on high dose corticosteroids for asthma. I think I was in the ICU probably twice a year for 7 years or so. And as I've come to find out, there's a lot of complications to chronic corticosteroid use, and I was on a lot of antibiotics as well. So a lot of issues down the road with that. But basically, to sum up that side of things, long story short, age of 12, 13, I basically woke up one day with just kind of debilitating low back pain. And I was an active kid. I would play soccer, basketball, baseball, always doing something. And largely that came to a halt almost overnight. And then began the process of trying to fix that. That actually turned out to be what I thought was going to be maybe a week or a few days, a year. My parents took me to rheumatologists, orthopedics, all kinds of different doctors. I hate to say it, I had 2 doctors tell me I wouldn't see age 20 at the age of 12 or 13. So that wasn't exactly nice to hear.
Like, oh, great, I got halfway down.
Right. So we were kind of at our wits' end, and we didn't have many more options, at least at that time. And friends of ours were chiropractors up in Columbus, Ohio, and we're down in Southwest Ohio. Columbus is in Central, and we decided to take a trip up to them. And long story short, they were chiropractors, and they were kind of utilizing the same type of practices that we do in our office now. And within, I would say, a month or two, my parents were driving me up and back to Columbus 2 hours each way, 2 to 3 times a week for about a month. They gave my life back. And at the age of 12 or 13, a light bulb kind of went off in my head, and I was like, oh, yeah, okay, I'll be a chiropractor. I think that's a good idea. But I think that it's rare for somebody to have a story like that at that age, that they kind of know their path at basically 20 years ago, I knew my path. And I think it's kind of cool that didn't really change. So went on from there, became a cross-country runner, track runner, endurance guy, which I thought was always ironic given my history of asthma, severe asthma. My brother and I went on to run cross-country in college. And then that's when my kind of second journey began, and it really kind of led me into functional medicine there. Around age 20, I started developing really bad like gastrointestinal issues, hormonal issues. And then the thing that ended my running career was I developed several stress fractures just kind of over and over and over again. And it turned out I had osteopenia, which is the precursor to osteoporosis. And if anybody knows that, the typical age range for that, it's definitely not 20. So that was concerning to me. I didn't want to be the 30-year-old that down the road broke his hip. So that kind of ended my running career and began my foray into functional medicine, nutrition, and stuff like that. And I'm happy to say now that was, it's hard to believe that was 12 years ago, but now I've since reversed all that stuff. And
dude, that's awesome.
It was a process, but I think that the thing for me is while I was suffering with that, all those issues for a while, I kind of know the reason behind it was, at least now, so I can relate to patients and other folks and be able to have answers for them too. So I kind of view it now as a blessing in disguise. So
that's awesome.
But yeah, I feel like a lot of doctors that go into that side of things, they've had to experience something themselves. And I think that relatability aspect of things makes you I think it makes you a more effective clinician, whatever type of clinician you are. So,
well, I think, and honestly, the feedback, not only that I would give you or whatever, is that you ask questions and you know that, like, as a patient or as, a friend or whatever, that you care and like,
right.
You're always like, hey, this is kind of initial thoughts or whatever. And I know the community really respects that. I know I love you for it. That's why I tell everybody, when you said, I think it was either on your IG or whatever, that, you know, you're driving or running down the road or running on the street and somebody's yelling, you're like, oh, dude, save my life or whatever.
I tell you what, this week, that's happened like 3 times this week, and I love it. So
I'm sitting there, I'm like, so it's not only me that does it? All right, cool.
Yeah. Oh yeah, that's what happens in a small town.
Well, it's what happens when people know, like when they've got a resource and they've got somebody that can literally help not only them but their family or their friends,
right?
Just feel better. Like, I mean, it's really what it comes down to is feel better and be better, and most places don't really have that, and if they do, it's, I don't know, maybe I'm biased or whatever. If they do, it's it doesn't get out that much.
Yeah, and I think that also being a chiropractor, there's always that kind of, I mean, it can be an outspoken or an unspoken stigma that's kind of associated with the profession. Like you even said yourself, like, oh, I don't know if I want to go see that guy. But I think that the thing with that is because I understand kind of sometimes the reputation that the profession can have, what better reason than to take a down-to-earth approach with it? Because if people understand that, hey, you're a real human being too, and you might have an answer for them. Hey, you may not know all the answers, but at least you have another option. Because typically, I mean, chiropractors are the last resort often. I mean, it was for me personally. So if we're the last resort, then all you can do is try your best as a clinician. And usually, I mean, the beauty of what we do and what we recommend is it's generally low risk, and it usually can result in an outcome, especially if they haven't had that type of care before. So.
Right on. Well, man, I appreciate you sharing all, I mean, honestly, just everything. You ready to jump into a little bit of carnivore?
Oh, let's do it.
All right, cool. So before I start asking questions, I want to read my own little disclaimer. Like this, y'all, if you're listening, and please do, if this is interesting to you or if you're getting value out of this, please like, comment, and share. I know a lot of people will get value from, one, just knowing that there's people out there like Dr. Brad and his wife, Dr. Mandy, and your brother's pretty cool too. So we'll give him a shout out.
He's all right.
I mean, I was maybe different topic or different. No, Adam's awesome too. But what we're getting ready to talk about is it's for informational purposes only. And because each person is so unique, just please consult your healthcare provider. If you do have any medical questions, or we'll probably throw Dr. Brad and Mandy's link as far as to GloyeskeFamilyChiro.com, if I remember right, in the notes, and any other information we do talk about, we'll tag. And if you're interested in the carnivore diet and you want to kind of maybe a reference, maybe you can tune back into, if you share and you comment that you shared it, we'll send you a link or just a little reference guide that'll make it a little bit easier. And obviously you can reach out to either one of us if you have specific questions. So, all right, are you ready?
Sure.
So the carnivore way of eating, like, what is it? Just base level.
You know, when people ask me that, it's almost kind of like, well, it is what it sounds like. And I think now that it's become more popular, I mean, when you ask somebody, have you ever heard of the carnivore this, and have you tried it? And now there's so many different versions of it. And I think that the gist of it is it comes down to, like, basically you're only eating, or you're eating the majority of your diet as animal products. And I always say that could be literally anything that comes from an animal. So in the broadest sense, yes, that means dairy is included, all of your milks and such. But yeah, if it is an animal or it comes from an animal, it's included. If you're hardcore and you don't eat any plants at all, then, you know, it's not included. I tend not to be dogmatic with it. With any type of diet, I mean, you and I both know that we're fans of keto. There can be a lot of dogmatism with any diet, not just keto or carnivore. There can be dogmatism with paleo and veganism and stuff like that. But carnivore has become popular as of late, mainly because I really do believe that it works for a lot of people. And we'll probably get into the reasons behind that. But yeah, animal-based nutrition.
So you're currently following a carnivore diet, and for anybody who's tuning in to Facebook right now, the very first half of our conversation, I had it set to me only. So they're tuning in like, oh wait. So you'll have to go back and watch the replay to see all the reasons why Dr. Brad is one, serving as a chiropractor, how he got into that field and becoming a provider. And then
you cut out, Kurt.
Good. That's perfect. Am I back? No.
Yeah, you cut out.
All right, cool.
You're there.
I'm there. You cut out for a second too, so I don't know if it's one of us or the other. But the cool thing about Zoom is when it plays it, Facebook actually does a pretty good job of filtering that stuff out. Can you hear me now?
Oh, cool. Yeah, I can hear you.
Awesome. So if you're just tuning in, watch the replay to see why Dr. Brad's doing what he's doing. But so you currently are eating carnivore now. How long has it been? I know that you did one stint and kind of did some testing just because I always follow your journey, but how long have you been back on it and for?
Oh yeah. Okay. So I've done kind of 2 forays into carnivore. The first one I did last year, and it was kind of short-lived. I did it for about 2 months or so. And I call that like traditional carnivore. So basically what that would be is, I'm your average 70 kilogram guy or 150 pound guy. I was eating anywhere from just 2 to 3 pounds of meat a day. I wasn't tracking anything. I wasn't really diligent about anything from a tracking standpoint, to be honest, other than I was trying to eat, your high quality foods, grass-fed, grass-finished, pasture-raised, stuff like that. And I felt fantastic for about a month. And following that month, I gradually deteriorated. Not in the sense that I became like physically ill or anything. I just started getting fatigue. And I think that for me, I didn't really understand why at the time. Come to find out, I think it was mainly almost all to blame as just mainly way too much protein. So I came to find out that what was going on is, with a guy like me, I was eating upwards of, and not to say this is bad, some people can tolerate this, but I was eating like 150 to 200 grams of protein a day. And that's just way more than your body needs. And I was getting glucose spikes up into like the 140 to 150 milligram range, which is like diabetic zone. Not like right after I ate, but in the middle of the night. So that wasn't good. And I think that was explaining kind of my fluctuations in fatigue that were random throughout the day. So I switched from then. I was like, okay, I'll go back to like keto, paleo, kind of what I was doing before. And I was still all right, but I was still struggling with fatigue and stuff like that. I was getting some aches and pains. I wasn't really able to run that much. So I did some research out of this group called Paleomedicina, and they're out of Hungary, and they're treating folks with really complicated conditions with what they call a Paleolithic ketogenic diet. That's PKD for short. And that's a carnivore diet. And the only difference between that and, say, if you want to call traditional carnivore, where you just eat as much meat as you want until you're full, they're really looking at like how much fat you're getting versus how much protein you're getting. So it's very fat heavy. And that kind of ensures like a stable glucose level. But they're treating really complicated conditions, anywhere from, your glioblastoma cancers, autoimmune conditions like Crohn's and ulcerative colitis, diabetes, even type 1 diabetes, getting just fantastic results. And they're actually throwing these into some of the medical literature. And it's pretty incredible what they're accomplishing. But I started that type of approach, the high fat approach, I'd say 3-4 months ago. And I got to say, it's been a game changer for me. It's been night and day compared to your traditional carnivore kind of approach. And I think the reason that is, and the reason that maybe this Paleo Medicina group gets such amazing results down there or over there, wherever they are, I think it just dramatically lowers inflammation, like just dramatically. Like to give you a little bit of personal anecdote, for me, my allergies went away. I've always had chronic kind of seasonal allergies. Those went away. I hadn't run for about 6 months or so because I think I told you this, I was dealing with what they diagnosed as synovitis through my left foot. And I even had some inflammation through my big toe, which with a big toe, it's kind of hard to run with a big toe problem. So, I mean, within a month, I was just kind of walking around every day and I'm like, man, things just kind of feel better. Like I wasn't waking up with like a limp anymore. And I'm like, I want to go for a run. And long story short, since I've adopted this, I'm running the most I have in the last 12 years, literally. So like this week, I'm on track for like 60 miles. And I haven't touched that and I can't even tell you. So I'm super thankful. And I think that's my daughter. But yeah, I'm super thankful. And I think that all in all, the reason that it works is there's a lot of benefits, obviously, a ketogenic diet, down-regulating inflammation. But then with a carnivore diet, the reason I think a lot of people get benefit from it, and you see this broad spectrum of people that benefit, is that I kind of view it as a glorified elimination diet. So when you eliminate all of the possible triggering foods in someone's diet, I mean, people don't realize this, but over 3/4 of your immune system is inside your gut. So if you're not essentially insulting your gut every time you eat, then inflammation is going to go down. And I think that for me and for several that have experienced just kind of random benefits from it, I think that that's the reason. So when you kind of marry the ketogenic approach with the animal-based or elimination diet approach, I think that's why people get better really quickly. So
that's awesome. So just broad term benefits, like definitely low inflammation for people.
Yeah.
Which, like you touching on, like as far as inflammation kind of drives pretty much a lot of the elements in the world. So you lower that, like you just feel better.
Yeah.
You can go with everything like that. So I'm trying to figure out how to word this other than just say, why would somebody look into trying it? Because that's the easiest way for me to word it. So trying to get fancy.
I think that the reason most people look into a diet in the first place is that they're struggling with something. And that something obviously varies from individual to individual. I think that the people that have found the most benefit, at least when I maybe kind of gently, lovingly tell somebody, hey, maybe you should try this, or maybe, hey, look at this research or look at that article. The folks that I've found myself commonly recommending that to has been your autoimmune conditions, for no other reason than they're obviously driven by inflammatory processes. But then your arthritic patients, there's clear data out there, and this just comes from me being a chiropractor. There's clear data out there looking at just sugar consumption with both back pain and arthritic pain, spinal pain too. So like when you just reduce sugar in and of itself, then a lot of folks that have musculoskeletal pain, that can get better. So I'd say your autoimmune conditions, your arthritic conditions. The other low hanging fruit for folks would be your type 2 diabetic folks, and then as well as the folks that want to lose weight. So, and I should preface that, not people that want to lose weight. You want to keep muscle, it's the people that want to lose fat. So it's a really effective way for people to lose weight and lose fat, obviously, because you're not eating any sugar, your insulin levels are down, and when your insulin levels are down, you basically just burn up that fat tissue. So, but yeah, I'd say those are the folks. And actually the first person that I ever maybe talked to this about had none of that. They actually were a former vegan, not to bring that up, but I think that they were struggling with, as a female, they were struggling with chronic skin conditions, acne, eczema, stuff like that. But more so it was debilitating anxiety. So when you come from, a former veganism approach to somebody like me who's just saying, hey, like, I think that this might be a good approach for you. What do you think about trying it? Here's some research. So she came in and I recommended everything, fully expecting she wasn't going to do that. so long story short, a couple months go by and she comes back in for a follow-up, and I'm like, man, like something looks different. And I couldn't put my finger on it. And her skin was clear. Her eyes were clear. The whites of her eyes were very white. And I was like, hey, well, like, I know that we talked about carnivore. I'm like, well, how'd that go? Did you do that? And their level of it? And she's like, yeah. I was like, yeah? And she's like, yeah. I'm like, well, how'd you do it? And she's like, I did what you said. I was like, okay. And she's like, I was eating a bunch of fatty meat, eggs, bacon, kind of everything that, the American Heart Association tells you not to eat, at least, every 2 weeks or whatever. And yeah, it changed her life. And to my knowledge, she's still eating that way, but it fixed her anxiety, fixed her depression, fixed her chronic skin issues. And again, like, people don't think about, like, oh, your diet impacts your brain. Like, yeah, it does. The whole gut brain axis is a real thing. So what you put in your in your mouth gets down to that gut, and it can affect your brain. So yeah, she had an amazing result, and I even noticed that, like, even the first foray into, like, the whole traditional carnivore approach, it wasn't like, for me, I did notice, like, an energy bump initially, and definitely some increased strength. But the bigger thing that I noticed initially was actually cognitively, like, mental clarity was through the roof. And I felt more stable. Not that I'm an unstable individual, but I just felt more stable in all aspects of things, so.
Well, I laugh because, you know a little bit of mine as far as the ketogenic or whatever, and hearing my wife tell other people the changes in me, her perspective was, Kurt is way more responsive versus reactive. And I'm like, she's smart. What's she trying to say? And I'm like, oh, I get it. I don't fly off the handle as much as I used to. Okay, that's cool.
Yeah. She's just being nice. That's what they do.
Yeah. I'm like, in a weird way, that kind of wasn't nice, but I'll go with it. So,
hey, at least she didn't call you a bad name or something.
Yeah, exactly.
Are we allowed to say those words on here? I don't think so.
I don't know. We'll find out. I'm sure I'll slip one time. So I think you kind of touched on it. Well, so if you shift to a carnivore style diet, do you, like, if you eliminate plants, are you missing nutrients or micronutrients or anything like that from plants? And if so, how do you get them back? Do you need them, or how do you get them back into your diet type thing?
Yeah, that's a common question kind of within the community. The short answer is no. Like, you're not going to miss any nutrients on a full spectrum kind of animal-based diet. You can get all the nutrients that you need in your body from an animal-based or a carnivore diet. I think the argument might come with a specific few nutrients, say like magnesium, vitamin C, vitamin D, selenium, stuff like that. And yes, like, there is a room for supplementing those things. I think it's all very contextually driven. So even if you look at some research out of the Paleomedicina group, like, if you're somebody who's diabetic, you're coming from a standard American diet, and you shift over to a carnivore diet, yeah, I mean, you should probably supplement, at least to a degree, with magnesium. It's not going to harm you. Vitamin C may or may not be necessary, depending, but I think that it's all very contextually driven. So things to expect, I think that if you're coming from never changing your diet to just going full bore into carnivore, I think that the number one thing that can happen is a gastrointestinal issue. Things might speed up or slow down depending on your ability to handle that much fat. So that can be a common issue. More so, things tend to get quick on you down there, if that makes sense. You might get diarrhea. And I think that a lot of people let that maybe deter them from doing the diet. And that's just, it's an adaptation that your liver and your gallbladder has to make. And that can last anywhere from a few days up to even 3 weeks. I can tell you, I didn't experience that and I was fine. There's things you can do to mitigate that issue. One might be bile salts. And this also might be a situation where you might want to include maybe a tad bit of plant matter like fiber, avocado, stuff like that, just to maybe slow things down a little bit for you. So I don't think you have to like always go into this as a cold turkey approach. I think that you can kind of incrementally phase things out and see how you feel along the way. But I think the magnesium and the vitamin C issue, those are the two most common. I think that people kind of lump all like conditions into one. So what I mean by that is, like, if you're looking at US healthcare, like 80% of people have chronic disease. Well, like if you're somebody who's in that 20% that's really, really healthy, you may not need as much, say, magnesium or vitamin C as, say, the person that's kind of classified in that 80% that has chronic disease. So what do I mean by that? I'll use magnesium as an example. So if you're coming from a diabetic history and you're insulin resistant, you're overweight, you're going to need more magnesium, no doubt, because you need that for insulin signaling, believe it or not. You need that for, over 300 biochemical processes in your body. But when your insulin levels start to come down, say on a carnivore or a keto diet, your need for magnesium actually goes down. So your supplemental needs will decrease. And actually it becomes more important to get sodium more than anything. So just increase salt intake, because if you're actually sodium depleted, you'll leach magnesium and calcium and stuff from your bones. So you have to make sure more than anything that you're getting enough sodium. But that Paleomedicina group out in Hungary showed that folks that were on this Paleolithic ketogenic diet for a time, they had normal magnesium levels and they didn't supplement at all. So I think it really is contextually dependent on, most likely at the end of the day, your level of insulin resistance. So if you're somebody that's, coming from a diabetic past or a pre-diabetic past, you might be somebody who needs magnesium kind of at the start, but as your insulin levels and your glucose start to regulate, you might need less and less magnesium itself and just supplement with sodium, or just increase salt. And I think the vitamin C issue, it's the same type of thing. So if you're coming from that same type of history, insulin resistant, diabetic, obese, overweight, you might need supplemental vitamin C in the beginning. But as your insulin levels come down, your inflammation comes down, you don't need as much vitamin C. So I think that, yes, you obviously need vitamin C for sure. In places that you can get that on a carnivore diet are things that people probably don't like to eat at the beginning, things like liver, all of your other organs, stuff like that. So yeah, I think that for me, you'll hear in the community that some people thrive off of, McDonald's hamburgers patties, and they've done fantastic with that. You know what? Good for them. Everybody's different. I think that for me, I like to play it safe and eat, an ounce or two of liver a day. Liver and egg yolks are kind of nature's superfood. So they're just packed with all those things that you might feel like you're going to miss if you're leaving out plants.
So if anybody's watching right now and they're like, nope, I'm not eating organs, I'm not eating liver, I'm not eating any of that, is there options available? Any type of supplements out there that you've
Yeah, there are. I mean, you could go a variety of different ways. I think that if you're going to go the optimal way, I think that there's a brand, Ancestral Supplements, no affiliation. Ancestral Supplements sells freeze-dried capsules of all your different organs, whether it's your liver, your kidney, your thymus, bone marrow, collagen, stuff like that. So if people don't like eating that stuff at the beginning, then that's something they can consider just popping a pill. I think for me personally, like when I first tried, for instance, liver, it was awful. It tasted terrible. And over the time that I've done this, I've actually acquired a taste for it. And this will sound strange, but it's actually become borderline sweet. So I think that people will find that if they give it a chance, their palate will change a little bit. Even their cravings will change, which is kind of cool. I may not look it, but you know, I have an addictive personality with sugar. So like the thing that I've loved the most about this approach is it's given me a level of freedom from, say, like sugar addiction. And I think that a lot of people don't realize how addictive sugar is. It's more addictive than all your narcotic drugs, caffeine, opioids, all that stuff. So when you take this approach and you feel actually truly satisfied after you eat and you're kind of destroying your cravings in the process, obviously there's going to be kind of an adaptation phase with this, but once you get to a point where you're not having those cravings anymore, specifically on the sugar side, it's a pretty empowering place to be, because I mean, it gives you so many freedom in so many other ways. Like food freedom is, I think, something that a lot of people are after. Like, I don't know about you, I don't want to focus on what I'm eating all the time. I'd rather go like do something instead, and live my life. So yeah, I think that's been another benefit for a lot of people too. It gives them on a level food freedom, which sounds counterintuitive, as limited as the diet sounds, but I think we're talking more cognitively or emotionally, that type of freedom.
When during, you know, my journey or whatever, it's somebody brings in a carry-in, or you go to a family reunion where there's, you know, all kinds of sugar products or whatever. The stress that came from that wasn't from, you know, could I eat it or not eat it? It was the stress of, if I just know how I felt, and then just kind of beat myself up or whatever. And then over the years, even though I still cycle through, like Halloween killed me this year. It was the first time in 7 years, but
yeah,
you know, having that, just not having to worry about that and not going through that stress. The only stress part of it was if, you know, my aunt or my grandma offered me something, just saying, oh, you know, I appreciate it. You know, finding a nice, that was the only stress in it. Versus in years past, it was stress for 2 weeks trying to figure out, oh, was that piece of cake I had 3 weeks ago? That's whatever. Anyway.
Yeah. And I think that people, like, for the most part, when it comes to a diet like this, or any diet really, it's like, how long am I going to have to do this? You know? And I think that for this it's a very sustainable way, provided that you actually give it a chance and adapt to it, to eat and live. People think that it's more expensive. It's actually not, if you shop locally, which we might get into a little bit, but it's a very efficient way to eat. But like, I'm still not dogmatic about it. Like, it's the holidays coming up. I'm not gonna, if I want to have a piece of whatever or have a drink or something like that, I'm not gonna hold myself completely 100% accountable to it. Like, I think that as long as you understand that, like, one, like, this is an optimal way to get all the nutrients you need and to reduce your inflammation levels. But two, if you just take the approach of like, okay, how do I feel? Like, if you do this, or any like approach that you're looking to change, from a dietary perspective, the number one thing is, how do you feel? Like, it doesn't matter what your blood levels are. It matters how you're feeling. So if you feel good and then you switch your diet and start to feel like crap again, then that's like, okay, like, maybe let's go back to that other way. So I think that there's a spectrum of things. Obviously, we're human beings. We want to live our life a little bit. But for me, I've always been of the mindset, like, okay, like, I'm very aware that I was eating this way. I felt great. I kind of veered off, and now I feel a little less great. Let's get back to that other way.
Yeah, 100%. And that's, I think a lot of people kind of classify themselves as a certain diet or whatever. And I've got buddies, you know, from the military that have shifted to a vegan lifestyle, and a couple of them have sent me messages or whatever, and I'm like, dude, do you feel awesome? And they're like, yeah. And I'm like, stick with it. I'm like, and if you ever don't, like, you know, I'm not trying to forecast your future or anything. It's like, as long as you're feeling awesome, dude, I 100% support you, and that's great.
Right.
Getting to that, buying local, is there a difference between like buying at your local supermarket or Walmart or whatever versus your, like, if you have an option of a local grass-fed farmer, grass finished type beef? What
I think there is a difference. I think I mean, there's a lot of debate, like grass-fed, grain-fed, conventional, stuff like that. At the end of the day, like all that stuff, all the animal products, all your meat, they're all nutrient rich anyway. I think that it comes down to what you can afford. Like Dr. Kinberry always calls grass-fed like panda massage meat. So like you don't have to do like grass-fed, grass-finished. I think the biggest difference with like your local supermarket or grocery store versus your farmer isn't necessarily the quality, although I mean, I tend to think that your farmer has a little bit higher quality. I think it's more as who you want to support. And I want to support our local farmers here. Like if you develop a relationship with them, especially when you're eating kind of the odds and ends that I am, like your beef fat and your liver and all the other stuff that I eat, they throw that stuff out. I mean, they'll just give it to you. I mean, you're not going to find it at your supermarket. So if you develop a good relationship with your local farmers and your ranchers and such, I think that's the more sustainable way to go. I think those folks need to be supported, and that's where I like to get a lot of my stuff. There's a few farmers around here locally. I'll go to McGuire Farms. I'll go to 37 Acres. And there's somebody else too that I forget, but yeah, I'll try to go local. And then I think it just comes down to like what's the most cost-effective way for you to do it. And if that's going to your grocery store and buying the tube ground beef, go for it. If you can afford to get your grass-fed, whether that be from your grocery store or your farmer, then that's fine too. I think at the end of the day is people have to realize like they shouldn't be afraid of red meat. They shouldn't be afraid of saturated fat. All that stuff is highly nutrient dense food, and it's meant to fuel their body. So yeah, I think that for me, I choose to support the local farmers just because that's how I like to do it. But it really just boils down to the individual.
All right. So honestly, I think this is like, y'all, if you're liking this information, like, please like and share. And if you'd like so it's a great little pamphlet that can help you a little bit along the way as far as what the carnivore diet looks like. Just share it and comment that you did share, and we'll send you a link to it. Last question. I know I get this. A lot of people were asking me to ask this question. What about cholesterol, as far as like if you shift to an animal-based diet,
right?
What happens there, and is it like troublesome, or what's your take on cholesterol as far as shifting over to carnivore?
Right. So I've had this roll through the office a couple of times, and I'll preface it with I'm not a cardiologist. I definitely don't have that type of training, but I do have a degree of knowledge in that kind of space, just given that I'm going to get that question pretty often. I think that the cholesterol thing is largely contextually driven, kind of like we were talking about with magnesium and vitamin C. I think it's a really poor decision to base a healthcare decision off of one or two blood levels, like your total cholesterol or your LDL. Those are the ones that tend to be looked at the most. The bottom line is, like, if you're going to eat more fat and cholesterol, dietary cholesterol, those things are going to go up. That's just the bottom line. I think that if you're going to look at a more like studied, well-researched marker to determine your cardiovascular risk, it's your triglyceride to HDL ratio. So if you're eating a keto diet or a carnivore diet, it's pretty well documented that your cholesterol is going to go up. But if say your triglycerides are plummeting or going down and your HDL, your good cholesterol, is going up, that's more so the ratio that you want to look at. So the lower that triglyceride to HDL ratio is, I mean, if you're 2 or less, then that's pretty good. Ideally, you're looking at less than 1 on that triglyceride to HDL. And all you do is you just divide that triglyceride number that you have or may have on your blood work and divide it by your HDL, and that's it. But you want to have that ideally less than 1, but if you're 2 or less, you're good. So if you're somebody that's on a low carb diet or a keto diet and those things are like trending up, meaning your total and your LDL cholesterol, that's not the end of the world. It's what your physiology is shifting to. However, if you're a diabetic and you're on a standard American diet, eating a bunch of sugar and processed food, and you're seeing those levels go up, your triglycerides are probably going to go up too. Your HDL is probably going to go down. That's going to leave you at more risk. And so I think that it's contextually driven, but I think that for the majority of folks, they don't really need to worry about like the total cholesterol or the LDL levels if they're on a keto approach and their blood sugar is stable, their insulin is low, and their inflammation levels are down. So I think that there's still more research to be done there, and you can always I actually had a patient, I mean, you go into your doctor, you get your standard blood work, and they'll run a lipid panel. And this particular patient was on a low carb diet, nothing crazy. And guess what? Her total cholesterol was up, her LDL was up, but her triglyceride to HDL ratio was about 0.75, so it was fine. They wanted to put her on a statin because her cholesterol was high. And I'm like, I understand where they're coming from. I mean, I don't understand, but I understand that's kind of what they do. So I was like, why don't they order a coronary artery and calcium scan? And that's where they measure the calcium content through your coronary arteries. And generally you want that to be 0. Like that largely means that like, because you're not driving your glucose really high and driving your insulin really high, those are the things that cause atherosclerosis or calcium along the arterial wall. So if you have that going on in your coronary arteries, then you know that you need to kind of shift something in your diet. Well, high cholesterol isn't the reason for that. And she went in and got that coronary artery calcium scan, and it was 0. So the doctor was like, okay, yeah, keep doing what you're doing. You look good. So
yeah, and
that's just proof in the pudding that it's contextually driven. So yeah, your blood levels may not look in the reference range, but that doesn't mean that the reference range is right either. So people kind of forget that when it comes to reference ranges on blood tests, who are we basing that off of? We're basing that off of the 80% of folks that are unhealthy. So yeah, it's all very contextually driven.
Yeah, that's one of my little hot topic buttons too. It's like, okay, is this optimal, or is this what?
Yeah.
Like if you're in a city versus out in the farm, like it varies where you live type thing. I don't know. Anyway, man, I had fun doing this. Like I appreciate you on it and sharing your story and just the knowledge that you have. I think it's helpful for people to at least get the information, and then they can look into, if it's something that's piquing their interest, like look into more of what the diet looks like, look into more of how you can shift your approach and just honestly feel better. Cause that's what it's all about. Dr. Brett said it earlier.
Yeah.
If you make a shift, you should feel better. You should
Right.
see results as far as like go from frowny face to happy face. I don't know what, that type of thing. So again, man, I really do appreciate it. If anybody wants to find out more about you, I know we'll put this in the comments and make it shareable, but what's the website? It's Gloyeske Family?
Yeah. Our practice is GloyeskeFamilyChiro.com. Gloyeske, we'll just spell that for you out there in the notes. And then you can find me on Instagram at Dr. Gloyeske, and then Facebook as the same. But yeah, I just encourage everybody to be your own advocate, do your own research, and do something that makes you feel better, or at least try. I think there's so many people struggling with whatever aspect of their health. I think the important thing is, like, there are other answers out there other than pills, potions, injections, stuff like that. I think that people have to understand that, like, food is literally what you make your body out of. So if that part of your life is out of order, then get it in order. And I think that things will improve for you. So
100%.
yeah, I appreciate you having me on here, man.
Well, thanks everybody for tuning in, and we will catch you next time. I'm going to stop the live stream now. See y'all. You want to say bye?